Hi everyone, today I'm joined by Dr. Omar Ibrik, internal medicine specialist and nephrologist working in a large hospital in Spain covering 500,000 patients. He has over 30 years of experience, and today we're going to be talking about the latest developments in the use of SGLT2 inhibitors. And so, Dr. Ibrik, in relation to GLP-1 agonists, what are the considerations for prescribing them, and when would you prioritize the SGLT2 inhibitors over the GLP-1 agonists, or would you use them together?
No, really, GLP-1 RAS now are indicated for the patients with chronic kidney disease and type 2 diabetes mellitus who don't meet their individualized glycemic target with metformin and or with SGLT2 inhibitors, or who are unable to use these drugs. This is what we do with GLP-1 RAS. Also, me, I give it for a patient with high obesity and chronic kidney disease and diabetes, because this helps them a lot more than SGLT2 inhibitors to reduce the corporal weight, and this is achieve also a better outcomes in chronic kidney disease, in the control, glycemic control, and the pressure, blood pressure, all these factors that maybe improve all the prognosis of this patient, you know.
Okay.
So only in this patient with high obesity, what we call morbidity obesity, and in Spanish, obesidad mórbida, in English, morbidity obesity. I mean, with a weight more than 100 kilograms, you know, this will help us a lot in reduce the weight and improve all the outcomes and the prognosis of this patient.
Okay, great. And obviously just now we already went through the vast amount of data that's coming out about the benefits of SGLT2 inhibitors, and I know that you've got personal experience of using them for 2 years already for CKD specifically. And so when can we see the guidelines updated to reflect this evidence that has come out about expanding the use of SGLT2 inhibitors?
The guidelines already contain this indication. This is, I mean, the most important guidelines that KDOQI of the last year of 2022 included the use of SGLT2 inhibitors. And I think that also in our space in Europe, we will in little time in the next months will include the inhibitor SGLT2 inhibitors in all the guidelines, nephrologist guidelines, endocrinologist guidelines. I'm sure, because the results and the outcomes of these trials, this is what we find now in our practice, in daily practice, in the real world.
Yeah, that's brilliant. It's definitely an exciting time to be working in this therapeutic area, and things are changing, you know, rapidly. So thank you so much for sharing your experience with us. I'm sure our physicians will benefit from your experience.
Welcome, April.